Good afternoon. I'm Bettina Hein. I'm the founder and CEO of Juli. Great energy in the house here. I'm so happy to be here. So I'm a serial tech entrepreneur. I've founded $200 million plus companies, and Juli is my third act, and I really want to make it count. We're all here to create impact, and Juli is squarely in SDG number 3, better health and well-being for the world. 50% of Americans, Juli's an American company, have a chronic condition, and half of those have more than one. Healthcare is enormously expensive. As you know, takes up so much of the US GDP. But at the same time, you'd think it'd be a luxury situation, but physicians, doctors, nurses, caregivers are suffering from enormous burnout, and there are not enough of them. And as you might know, the United States is one of the most unequal countries in the world when it comes to healthcare, especially for minorities and people of color. So Juli's here to solve a lot of those problems for people with chronic conditions. I'm a tech entrepreneur, so I take a tech approach to this. We integrate previously siloed data. So we take everything from your smartphone, from connected devices and wearables. We take in environmental data like weather or air pollution, sunlight hours, humidity. We pull in all of the data from your electronic health record, and then we tie that all together with patient-reported data. And we do that in two ways. One part here is our patient-centric, engaging app. We try to compete with TikTok and Tinder, not with the typical staid health app. What we then do with that data that we gather is we take these large amounts of data and build complex models out of those to find patterns. And we feed that data with recommendations through APIs to the clinicians in their workflows, as well as to the patients themselves, so that they can do something and change their behavior, change their regimen. We try to close the inequality gap because we don't need those expensive devices. We don't need any special connections. We take what most people already have in their pocket, their smartphones, maybe an inexpensive Fitbit. We also help close that resource gap. We tell clinicians, care teams, which patient is in trouble, which patient is fine, and which patient needs their help right now before things get worse. And we also gap that time between care visits, giving clinicians the thing that they want most, which is more time with patients to help them. We've been around for 2 years. We have over 20,000 patients onboarded onto our app, and we've been able to show that we can improve health state across chronic conditions. For example, here you see some outcomes that we see. For example, we've been able to show that after 8 weeks, we improve depression symptoms by 22%, and others that you see here. I am enormously proud that I've been able to recruit a world-class team of experienced entrepreneurs, digital health pioneers to help me build Juli. I'd like to mention that we're also a team that has more than 50% women and people of color on it. And we're speaking to investors now, so if you're interested in helping us making people with chronic conditions better, come talk to me, or my co-founder is also named Bettina and is wearing the same colors. Thank you very much.